Welcome back, East Texas. We're joined now by oculoplastic surgeon Jordan Spindle with Heaton Eye Associates. Thank you so much for joining us here today. So what is oculoplastics actually?
Oculoplastics, think about it as a very specialized area of plastic surgery. Not only that, you get the benefit of a board-certified ophthalmologist as well. So kind of a foundation of ophthalmology with a specialization in the tissues around the eye and very focused on the plastic surgery and reconstructive surgery of that area.
So what do people kind of ideally want with this reconstructive surgery? What's the goal, I guess?
Right, well, it's different. I take care of 1-year-old babies that are born with droopy eyelids to 101-year-old patients that have age-related eyelid issues and everything in between. Most commonly, it's young to middle-aged patients that come in and have some extra tissue above their eyes or even bags below their eyes. And they want to see better, look better, and all those things. And there are a lot of non-surgical and surgical options we can offer them.
So under the eyes, you make us look more awake.
That's the goal.
All right. So is this something that's covered by insurance? I feel like typically plastic surgery is not.
Sometimes. It depends. Okay. If skin is hanging over enough where it's impeding your vision, difficult to read, I have to lean my head back to see, I can't see when driving, I have to turn my head more, things like that, then oftentimes insurance will cover a lot of the surgeries.
So I know some people flinch at even eye drops or somebody blowing in their eye at the optometrist. What does the recovery look like for a surgery like that?
Sure, that's a common question we get. We typically try to keep everybody very comfortable, whether it's IV sedation or something from that aspect. The surgery's 30 minutes, an hour at the most. And most people do very well. It's not a painful surgery. People go home, put a bunch of ice on it, and we see them back the next week and do very well and recover very quickly with very minimal to no scarring.
So maybe out of work a few days, a week?
Depends on what you do.
Okay.
In terms of somebody like you may not want to go to work the next day, but other people can, if they're at a computer or something like that, can really go back to work a day or two later.
So is this something that can help your vision then, or is it more just kind of physically appealing type?
Kind of both, and sometimes we'll get both benefits out of that. If somebody comes in and just says, I don't like these bags under my eyes, we can do that, and it's really regenerative. And it's not that you don't have friends saying, oh my gosh, who did your surgery? People come back and say, yeah, everybody's asking me, did you get more sleep or been on vacation? Or so it's very subtle, yet if you look at that side-by-side photo, there's a big difference there. And then sometimes
a lot of scarring or anything?
Very little, and a lot of times there's no scars or no incisions on the outside to get rid of the bags below. On the top, the incision's hidden in the crease of your eyelid, and so we really don't have issues with scarring at all.
Interesting. So if people think they're a good candidate or want to learn more about Heaton Eye Associates, where can they find those details?
They can go to our website, heatoneye.com, or call our office at 903-526-0444. We have a separate Oculoplastics Institute next to Heaton Eye Associates, which I think is the premier eye care institute here in Tyler, and they can come talk, we can have a consultation and see what they qualify for.
All right, thank you so much, Jordan, for stopping by here today to tell us about that.